Hello everyone, my name is Sufia Imam. I recently completed my MBBS from Jinan University, which is located at Guangzhou in China. And this video is about my experience of internship at the花桥医院, which is also known as the first affiliated hospital of Jinan University. My apology for my bad voice because I was down with fever from last 2-3 days. So I'm just in the recovery phase right now. Sorry for my bad voice, please bear with me. The reason why I'm making this video is because a few of my classmates and friends are going back to China to resume their mixed practical sessions, which they couldn't do during the COVID-19 pandemic. And they would also be doing their internship at the花桥Yuan. So this video I hope this video helps them, as I will be highlighting the basic and the important points which they should keep in their mind while starting the internship over there, because I believe they'll be visiting the university after a long period of 2.5 to 3 years. So this video is just to make them feel relaxed, that there is nothing to feel worried about it. They can enjoy their stay in the campus once more and start and finish their internship on time and then come back to India safely and happily. So let's begin. Now the internship in Jinan University is 1 year, okay, and you will be getting the students or the interns, I would say, they will be getting a schedule of each and every internship in their respective departments, and they will be getting it a very well planned, and everything will be provided to them. During my time, I did my internship when there were cases of COVID-19 pandemic in China, but not a lot of cases, just a few cases here and there. And but there were a lot of cases outside China, and that's the reason students were allowed to come back to China. So we had a 1 week of training session before the actual beginning of internship at Huaqiao, and that was purely online. And what exactly happened in that online session was that we were given some kind of basic informations of how the internship would begin, as in at what time should we report, what should be a code of conduct over there, how we should be present over there, and how we should behave over there, making us aware of the different departments and routes. So everything was done in an online mode for a period of 1 week, I believe. And there were different doctors, different teachers who shared their experience and gave us the important information in the form of PowerPoint, PPT slides. And it was completely in Chinese, it was in Chinese. We'll come to the Chinese part later on, okay? Let me first finish up, just highlight the points of internship, and then we'll come to the part later on. So the basic preparation which you have to keep in your mind when you visit the Huaqiao Yuan for internship is that you need to have your apron, that is the white coat, and I would request to have at least 2 pieces, because over there you have to wear your apron all the time in the hospital, properly with your buttons properly arranged. I mean, you cannot just put on the apron and unbutton it here and there. It should be clean, ironed, and the button should be properly placed. And so I would request to have 2, because you won't get time to come every day and wash and then keep it for drying and then iron and then doing the ironing and all that. So just to save your time, it's better you can buy 2, and I would say you can buy in China, because I think in China the cost of the apron is less. I bought myself in China, and I think I just paid 30-40 RMB for just one simple apron. So it depends on you. If you want to buy it in China, you can go ahead. It's not very expensive there. So you have to go to the hospital every day during your duties, wearing your apron properly. Keep pens a few pens, not just one pen, a few pens, because you might keep it here and there and it might get lost. It might get lost, which means that nobody will take it purposely. It's like everyone, the nurse and the other healthcare workers and the doctors, they sometimes need pens to write. So if they don't find there, you give it to them or they pick up yours, and then you might forget that to whom you have given, because there are so many people over there in the hospital, in your department, or in your ward where you will be doing your internship. Keep a small notebook. Why? Because there'll be a number of bedside teaching, a number of ward sessions will be there, a number of webinars or seminars will be there, a number of small case discussion or detailed case discussion will be there. You can write down the important highlights, like the diagnosis of the patient, the chief complaint with which the patient came to the hospital, the age, gender of the patient, and the present medication on which the patient is there at that time when you're visiting him or her, the bed number, all these things you can write down, the name of the medicines you can write down, and so that when you go back and when you review what you have done in your entire day, and when you see that, okay, for example, this patient was there in the hospital and she was suffering from sarcoidosis, so you saw this in the symptoms. Now you can go and open up your notes and see the symptoms and signs of sarcoidosis, and you can have a second revision because you've already seen a real patient. So you can just go back and open your textbook and have a revision, and then you can add those points, and that will serve as a long-time memory for you. Okay, the next important thing is your stethoscope. Please don't forget to carry that. There are many stethoscopes available in the hospital in every department, but I would request to carry a personal one every time in the pocket of your apron, because at times you're visiting patients, you get a chance to listen to the lungs of the patient. You get a chance to listen to the heart rate of the patient. So you see, the more your ears hear, the more experienced they become, and the more your memory becomes strong when it comes to the different types of murmurs, when it comes like how does a wheezing sounds like, how does there are so many other lung sounds, right? So your ears will become experienced in that. So always carry your personal stethoscope. Okay, carry a small bottle of sanitizer as well. There are sanitizers everywhere in the hospital, from the entrance till the exit, everywhere. But I would still request to just carry a small bottle, and you can refill it whenever, after 2-3 days, whenever it gets over. Because maybe sometimes you are at a place where there is no sanitizer, or you don't have time to walk a little and get that bottle. So you can just take out from your pocket, rub, and go ahead with your next job. Okay, of course, mask is mandatory in the hospital. You will be given mask in your respective departments during your internship, weekly or after 3-4 days. They give a lot of mask to everyone, so just make sure you don't lose them and you wear them every day. So since they will be giving you mask which is free of cost, you don't have to pay for that. You can just reuse, you can use a new one every day. You don't have to reuse an old one and keep it and wash it and do all that. No, you can just use for a few hours and throw, and then use another new one whenever you feel like. Okay, carry a bottle for drinking. Keep yourself hydrated, because even though they won't let you do a lot of hard work, I mean, the work is not hectic over there, but still during the ward sessions, during the bedside teaching, there will be times where you will be just standing from 8 o'clock till 12 p.m. like till your lunch time, from morning 8 o'clock, because whenever there is the ward round, it takes a lot of time to get over. So you might you might feel dehydrated, you might feel thirsty. So carry a bottle, preferably an empty bottle. There is no need to bring water from your dorm, because over there you will get cold water as well as warm water. So you don't have to fill your water bottle and bring, just bring an empty bottle and keep in that department. department. You don't have to take it back to your dorm as well, because if you're there, like suppose if you're there in the pediatrics department in the NICU section for 2 weeks, there are arrangements made over there for the interns to keep the apron, to keep the statos, to keep their bags, their books, their notebooks, and their bottles. So you don't have to bring it every day. You just have to keep it there, and on the last day of your duty on that respective department, you can just take it back whenever you're free. If you can also carry a few coffee sachet, since there is hot water available all the time over there. Whenever you feel like tired, then you can just use those coffee sachets. Many students, many interns, they carry a spare footwear, because staying in the shoes all the time for 12 hours or 15 hours is not comfortable for many of them. So you can carry a simple, not an expensive one, a slipper or a shoe, and then when you go in the morning before 8 a.m. and when you change in the doctors or interns changing room, you can just change your shoes and wear the comfortable one. You are allowed to do that, so you don't have to worry about it. And yes, also carry a small tube of hand cream. Why? Because you will end up washing your hands at least 20 times or more than that in a day. If you're examining a patient, if you're touching the patient, listening to his or her heartbeat or lung sounds, if you're touching a neonate, a newborn, you have to wash your hands before and after, right? Before and after touching the patient, and after touching any patient's articles, any stuff of the patient lying around. So like it might be possible that you end up washing your hands more than 20 times in a day in the hospital. So your hands at the end of the day would become very rough and dry. So just carry a small tube of hand cream. This is especially for girls, I'm saying. So they can just, take a small hand cream and rub it around their hands, and that will give you a smooth feeling. These are the very basic stuff which you have to carry with you when you're going for your internship. Other than this, I don't think so there's anything important. Of course, your ID card. They will be giving you an ID card which you have to carry with yourself every day. Make sure you don't lose it. Make sure you don't give it to anyone else. Why? Because those ID cards are not just a simple ID cards. Those will serve as a electronic pass for you to all the departments where common people like patients, their relatives, they are not allowed to enter everywhere in the hospital. But you as an intern will get the liberty of entering those sections like NICU, ICU, the OT sections, the anesthesia, the post-op sections, the different departments and their wards, the first class rooms of the patients. Not everyone can enter there, but you as an intern will get an opportunity to enter there. Either you go there alone because of some work given to you, or you go with your supervisor or your doctors during your ward rounds. So make sure you keep that ID card properly. It should not get lost, and do not give it to anyone else. If it gets lost, you have to report to your supervisor, to your senior as soon as possible, so that they can give you another one. Because at the end of the internship, you have to return this ID card to your teacher or the head of the internship in charge, whoever the teacher will be at during your time. Because unless and until you return, they won't give you your internship certificate. So it's very important to keep it safely. Okay, these are the basic things which you have to carry with you. Okay, now let's move to the second section. Now, department wise, you will be visiting OBG department, that is Ops and Gynae, surgery department, and then there are different different departments in the surgery internship, like orthopedics, cardiosurgery, then the lung surgery section, then you have thoracic surgery. You will be getting a chance to visiting all such departments. Medicine, all the medicine sections like cardiology, neurology, surgery, endocrinology, what else? Nephrology. For pediatrics, I think 1 week or 2 weeks in the NICU, and 2 weeks in the pediatric ward, and 2 weeks you will be spending at the community health center, which is, I hope you remember, which is just opposite to the Sunshine supermarket. There is a football playground, right, where, and the athletic ground where the sports occur every year. Just next to that is the community health center, where you will be spending your 2 weeks over there. And then at the end there will be an optional, I think 3 weeks of optional internship, where you will be given a list of departments, and you have to choose where you want to work. For instance, in this optional, you can go to dermatology, you can go to ophthalmology, you can go to ENT, you can go to neurology, and you can go to go for the radiotherapy department and radiology. Yes, so you have to choose one department, and the last 3 weeks of your internship you will be spending over there. Like in my case, if I tell you, I went for neurology because I wanted to see some of the neurosurgeries. So that purely depends on you. Okay, it depends on your interest and which subject or department you like the most. Okay, so let's move on. Yes, let me tell you the number of weeks. 16 weeks for internal medicine, 16 weeks for surgery, 8 weeks for OBG, 6 for pediatrics, and 2 weeks at the community health center. 4 weeks is your elective internship, which is at the end when you will be just finishing it off. Okay, let's come to the next part. Case reports. Before your internship will begin, you will be given a number of booklets. Okay, you will I think they will inform you. They will do everything for you. They'll give you booklets, nicely printed and properly new booklets, and those booklets you will be using it when you will be visiting those those departments for your internship. You will use that booklets to write the case reports. Okay, so right now I don't have, because we have to submit that. You have to, all the interns have to submit that in case reports before sitting for the final or scale exam. So I don't have right now any hard copy to show you, but it's just a simple booklet, and the subject is written, like for example, if you say that this is a case case report booklet of surgery, so all the department's name will be written. Okay, and the number of cases will be written that you have to write down. 2 cases of cardiology, 2 cases of neurology, neurosurgery, or 1 case of cardiothoracic surgery. So it will be mentioned over there. You don't have to worry or memorize all that. What you have to do is that whenever you're there during your internship in that respective department, whenever you're seeing the patients with your seniors or allotted doctors, make sure you choose any 2 or 3 patients. Okay, you can ask your supervisor also that, Lausher, I have to write my case report, so can you please suggest me for which bed number or for which patient number should I write. Sometimes they tell you, sometimes they say that it's okay, you can choose any patient as you wish. So it depends on the teachers, on the doctor's mood over there, right? So as soon as they tell you, make sure you collect all the information, okay, before you end your internship in that respective department, and make sure you write it down. Since we have done MBBS in English, we have the liberty of writing it in English. So you don't have to worry that do we have to write in Chinese or not. No, we can write in English, right? And then make sure that before you leave the department, your supervisor corrects that, gives you score, put his or her signature. Make sure you take the signature of the director of that respective department, of the in charge of that respective department of your internship, and of your supervisor. So these 3 signatures are very important. The reason why I'm saying this is because later on when you go to another department, okay, you won't get time to return, right? And at the end of the session, when you will be just finalizing everything, and packing your stuff and preparing for your OSCE exam, it will be very difficult for you to again go to the department, look for that doctor, look for that director of the department, your supervisor, and request them to give the signature, because they are also busy. Okay, sometimes they are here, sometimes they're in another department, sometimes they are in OPD, sometimes they're in OT. So make sure when you're there in the department itself, you finish off this work. This will save a lot of your time, and this will prevent you from headaches, unnecessary headaches in the end. Regarding the case reports, they will give you an example of how to write the case reports, okay, and it will be completely in English. Once you write it down once or twice, show to your teachers. If there are any mistakes, they will let you know, so you don't have to worry about that. The case reports are handwritten, they are not typed, okay, so you have to write it properly, because usually one case report is like of 6 to 8 pages, right? If you write it down properly, mentioning each and everything, so if you make a mistake, then you have to redo it, and which is again a headache, I would say. So make sure you write it properly in the first go only, so that you don't have to rewrite it. And okay, so we are done with this. Next thing is that regarding examination. After you complete your internship of each and every department, there will be an exam, theory and practical. For instance, if I'm doing my internship in surgery department now, okay, and like 16 weeks I have done, yesterday I completed, okay, they will inform 1 week or 3 days prior that usually it's the end of the week, so which means on Friday they will say that internship is getting over on this Friday. So in the afternoon there will be a theory examination for surgery. Come well prepared. The examination is fully MCQs, unless and until they tell you that it's subjective also. You can also ask from your part if it is subjective, but most of the time it is objective. Like in my case, it was objective. It was just MCQs and MCQs, okay. So yeah, that is the theory exam, and which will be followed by practical soon after your theory exam gets over. Like 1 hour they give us for the MCQs, like 50 MCQs, I believe, 50, not more than that. And then after that, soon we go to that clinical skill center, which is building number 3, second floor. I hope you all remember that. So we go there and we do the practical over there. There is nothing to worry about that, nothing to feel nervous. Whatever we do in our internship in the hospital, whatever we see, those things are being asked, okay. So don't get panic. The only thing is that the teacher sees actually how much attentive you were during your internship in that particular department, right? And they will tell you the topics which will be there in the practical. So even before the practical exams come, there's going to be a practical examination after your internship gets over in every department. So before the practical examination dates are announced officially, ask your seniors, your juniors and teachers, and they will let you know, okay, what will be asked from you, or what they want you to know for the exam, so that during your internship, during your training session in that department, you can practice that. You can see how it's being done. Like for example, if I'm doing my internship in OBG, right, and I asked my senior that, okay, what are the topics I have to prepare if there's a practical examination of OBG at the end of 2 months. So they said that, okay, you have to know how to do per-vaginal examination, you have to know how to examine a pregnant lady, you have to know how to do a Leopold maneuver, okay. So these are the basic things, okay. So whenever there is a patient over there in the OPD or over in the inpatient department, they are seniors, they are doctors who are doing Leopold maneuver, who are doing per-vaginal examination, you see them first. And whenever you get a chance, you request them to practice on real patients, okay. You can practice on real patients. So this is a myth, or this is a lie, that you don't get to practice. You do get to practice on real patients, because I have done it on several patients in every department during my internship. It is just that you have to observe first, understand first, read a little bit, stand next to or behind your supervisor or senior, see how they are doing, ask them to help them, request that you are also interested, so you can quickly sanitize your hand over there and you can go ahead. They will be very impressed to see this. It's not that they will not allow you, they will allow you. It is just that you have to show your effort, you have to show your interest. And this is for every department, not just for OBG, even in the pediatrics. When you go in NICU and when you just see a newborn of just 1 hour old, imagine 1 hour old newborn, right, of 6 hours old newborn. So they will send you once or twice in a week to check their bilirubin. Okay, they will give you a bilirubin meter and they will ask you to check all the neonates bilirubin level. So you will be like going and checking, and some of the neonates, they are just like few hours old because they were born last night and you came to the hospital early morning at 7. So you'll get to see that there's another baby here. So you can check their bilirubin, you can measure their bilirubin. You have to measure, actually you have to write it down on a piece of paper with the name of the kid, the name of the neonate, on which day, at what time, on which date he or she was born, and was there any complications or not during the delivery if you were not present at that time because you were there somewhere else doing some other duty. You have to mention all that. And as I said, carry your stethoscope, because this is a very good opportunity to hear the heartbeats of a neonate. Like, see a neonate of 7 days old or 7 hours old neonate, or so you will get a very wonderful opportunity to hear their heartbeats. There will be cases of premature delivery, that is preterm baby. Like when I was there were like 3 to 4 kids whose mother was suffering from SLE. So usually SLE pregnant ladies, they have to deliver before the complete gestation period. Yeah, usually it is the preterm baby they deliver. So you get to see that how they are being managed, how they are being brought in the NICU, and then how they are being given oxygen, and if they're suffering from respiratory distress, asphyxia. There are so many other conditions. You will get to see a lot of neonates having pneumonia over there. Kids in the pediatrics ward, when you'll go, you'll see 4 to 5 years old small boy or girl suffering from Kawasaki disease. And so you can see their features of the Kawasaki disease. You can see the signs and symptoms, right? So don't miss these things. These are the small things, which, these are actually not very small things. These are important for us. These might look very small and boring in the first, because you might feel bored, because you might see that everyone is speaking Chinese, but you have to you have to pull, and you have to stand there and learn and see as much as possible, because there will be a lot of wonderful cases over there. When I was there, I got opportunity in every department to see very good cases, and so don't miss them. Just be there, stand behind your supervisor, see what they are doing. At that time they might be busy because they interact with the patient's family and give them further instructions. Later on, when you see that your supervisor is free or your senior is free, you can request for an extra free hour, sit and discuss of that particular patient. Okay, if you don't understand, ask them. They will be so happy to tell you, because I have done that and I know that how happy they feel. So that's a very good thing for you to learn and understand. So it's like if you ask them just this much, they will tell you this much. So that's going to be very good for you, especially for those people who have not yet given the FMG exams. For people who have given the FMG exams, for you people, it will be more interesting, because now you all are well versed with your theory parts. Okay, so when you go to the hospital and when you see a Kawasaki disease patient, a baby, you already have learned about Kawasaki, okay, during your SEM exams, during your FMG exams. You know the signs and symptoms and the treatment protocol. So when you go and see, it's like, your eyes know what your mind can read, right? You know what you're going to see in that child. So you can easily correlate, and this is going to serve as a lifelong strong memory, permanent memory. Okay, so and same is the case with surgery. When you're going for surgery, make sure you know few basic stuff. That is, they will teach you, for sure they will teach you, okay, but if you know by yourself, okay, and if they ask you, because they do ask you that do you know this how to do, do you know this how to do, and if you say yes, they will be super impressed by you, and then they will tell you to do it in front of them, and when you do that, then they'll be like, wow, come on, join me as the second assistant, join me as the first assistant in OR. So that is such a proud moment, right? So what, like for surgery, I'm saying, before going to the surgery, make sure you know the how to wash your hands. It is very, very, very important. You know, washing hands, you can go back to your WHO and CDC website and see that that picture which gives a nice information of how to wash hands. Make sure you know how to do that. Make sure you know how to wear gloves properly. Make sure you know how to put on your surgical drapes properly, and also how to put off them, that is how to take out them at the end of surgery. All these things are very basic, but these are very important, because you know that when you're entering a surgery room, you and other doctors, our first aim is to avoid unnecessary infection to the patient, right? That is the reason why we are told to wash our hands prior to entering the OR, and wearing the surgical drapes properly, wearing the surgical gloves. You will get to see them doing that same, but if you know it before even seeing them, if you have practiced at your home, there are a lot of videos in YouTube, you can see those videos, then things become easy, because see, the more the teacher, the surgeon feel confident on you that okay, this intern already knows and she did it so well, she knows how to wash her hands, she knows how to put on the gloves, she knows how to put on the surgical drape, and then so all the time they will ask you to come and help them in their surgery, to hold while doing a laparotomy or a laparoscopic surgery or hysteroscopy or surgical removal of uterus or a thyroid surgery or a aortic dissection surgery or a mitral valve repair. You will be considered as their intern of choice, I would say. Just like we have drug of choice and an investigation of choice, you will be considered as intern of choice, and they will call you, and then you can be in the OR, you can see how things are being done, you can see the temperature of the OR room, you can see at which side the doctor or the surgeon stands to the patient for doing a surgery, and how he or she is done. You can see all those anesthetic work going on over there, because when you're in surgery, you actually don't learn from surgery, you also learn from the anesthesia people. You have on the head-on side, you have the anesthesiologist standing over there, so you can see what are the drugs they are giving, okay, how they are intubating the patients, what kind of inhalation drug, anesthetic agent the patient is giving, are they giving patient any blood transfusion and all that. So when you're there in surgery, you actually get to learn two subjects at the same time, I would say, surgery as well as anesthesia. So you will really enjoy it. Of course, it's very tiring, it's very, very, very tiring. There will be days in surgery where in a day you will have 4 or 5 surgeries, right? And then you will be like tired from 8 o'clock in the morning till 6. You will be just in standing mode, you won't get time to sit also. You might just get 20 or 30 minutes to go down and have lunch. After that, you come back and resume with helping. But those memories, those experience, those kind of practical knowledge, I would say, it's going to serve you as a permanent memory, and it's really going to help you if you really find surgery interesting. But for me, I found it very interesting, and I found it very tiring as well. So for people who want to go ahead with surgery as their profession, make sure you take the best from the OT. Make sure for 16 weeks surgery, you don't spend much time in the inpatient department. You spend most of your time in the surgery OR section. That's it. And you will get to learn a lot. Okay, in the beginning, the teachers, they might not ask you to come, because usually interns are not that much interested in going to ORs all the time. It is hectic, that's why. But if you request them, they will definitely say yes. And once you go there, you show your interest, you show your sincere effort over there, then you're going to have a lovely time over there. Then there is no boring time for you if you're really interested in seeing various kinds of surgeries, because there'll be a lot of wonderful cases to see and learn from them. And after the surgery, you can discuss with your teacher, also with the doctor, that why this and this surgery was being done, what could be the complications, and what things are they doing, what are the drugs they are giving, or what is the next protocol to avoid such complications. And then you can go back to your room, read about that particular surgery, that disease for which the patient had that surgery, how much successful it was, what could have been the complications and the blood loss, and so on. So this thing is going to serve as I'm saying it again and again, as a permanent memory for you all. So just like that, this is for like every department. This was for surgery. For every department, they will see your effort first, my friends. I'll tell you, nobody will tell you over there to do this work and that work all the time. Okay, so don't worry that it's gonna be very hectic. There are a few students there who just spend the entire day sitting in the inpatient room or in the doctor's interns room playing video games, not doing much work. So I think that's of no use, right? We all travel so far so that we get to learn and understand a lot from the internship, right? Internship is not about sitting in a room, right? It's about moving in and around the inpatient department, the OPD, and in the surgical rooms, the OR. So be prepared mentally and physically that you're going to spend a lot of your energy and a lot of your time in these OPDs and OR and inpatient departments, and not just sitting in a room in the corner. Okay, sometimes like most of the times, like when you're doing your internship in the internal medicine department or in pediatrics, they will be ward round by the chief, by the director of the department, and those ward rounds are very, very, very long. It's like it starts from 8 a.m. it would end by 12 p.m. They see specific cases over there, patients, so you'll get to see some nice cases. Like when I was there, I got to in pediatrics, I saw 3 patients of SLE and their complications, 3 patients of Kawasaki disease. I saw, when I was in this OBG, I saw a patient with cancer, ovarian cancer, chocolate cyst, and then a lot of cases of abortions, a lot of cases of, there were 2 cases of twins. So see, it depends, it's everything will be there for you. It depends on you. How much do you want to see? How much do you want to understand? How much do you want to read? Okay. And yes, that's it. There will be 1 week of your duty in the ECG department, right? So there you have to do ECG of patients from like morning 8 till 12, and then from 2:30 till 5. So in a day, you could end up doing ECG personally by placing all the leads, recording the ECG in the system, and then finishing off the ECG procedure by telling the patient to get it properly and to dress himself or herself. So in a day, you could end up doing ECG of around 500 to 400 patients. That depends upon the patient load. When I was there, alhamdulillah, there was a lot of patient load, and it was like we did ECG for so many patients, and it's a wonderful experience. And they will ask you for a 1 day 24-hour night shift in the ECG department, where you will stay in the department in the ECG, and you could get calls at 12 a.m., at 1 a.m., at 1:30 a.m., 2 a.m. Asking to come immediately because the patient is not able to breathe properly, the patient is not feeling well, so they want to do an emergency ECG. So you could get a call from any department, and that time you have to just rush with the ECG machine with and all the leads. They are all packed in a bag priorly. You have to go there, place all the leads properly, do the ECG, take the print, and then come back, knock at your supervisor door, request her to see if it's normal or if there is some severe issue. Because if it's normal, then fine, okay. If there is some severe issue, immediately the supervisor will call to the doctor of that respective department and give the diagnosis so that further medication or treatment could be done. So these things might sound a little much, like I don't know how it sounds to you, it depends, but these are actually very, very interesting. Trust me, very interesting, because when I did this, I used to feel a little scared because I was alone over there, but I had a lot of fun over there. Even being the only international student, the only student from my class doing internship in an offline mode, I thought I would lag here and there, and I might have lagged also, but then I would say my overall experience was wonderful. There was so much to learn that I couldn't learn everything because I used to get tired at the end of the day. So these things are there, and let me see if I have missed anything. I have highlighted the important stuff, and regarding the final examination, like I said, there's going to be an examination, theory and practical, at the end of each internship rotation of your respective department. After that, when you finish off your elective internship department, and then they will tell you that on this day there will be your final internship examination covering your entire 1 year information, your experience, your knowledge, and it will be purely practical. It will not be theoretical, okay. So I think practical is more easy than theory, I would say. I used to think theory would be easy, but I think after giving my OSCE, I think practical is more easy. So they will be like, it's gonna purely be an OSCE examination. It's gonna be really fun. The way they arrange the exam it's wonderful. You'll really feel like you're giving some kind of big examinations, okay. So it's gonna be like in that same clinical skill center room in that third building. There will be rooms, like a room number 1, 2, 3, 4, like that. There'll be 9 rooms. 9 rooms will be there. They will give you your schedule to which room you will be going first, second and third, and as soon as the bell rings, you enter the room, you pick up a paper, whatever is the topic, you perform that practical. If the teacher has to ask any question, you answer them, and as soon as the bell rings again, you come out. Then there'll be a third bell where again you enter to the second room for your second practical session. So it might sound little worrisome or nervous, but trust me, it's going to be very, very interesting. And the practical sessions, whatever they ask, is what you see the doctors doing in the ward during internship department. Like I said in OBG, you should know how to do lip-on maneuver. You should know how to do pervaginal examination. You should know how to take case history, from a pregnant lady at what her week of gestation. Is she a preemie, and is she married? You have to note down the patient's registration number, the patient's name, gender, everything. Such small trivial things are being asked, and points are given on that. And they will ask you to do CPR in the OSCE examination. So you should know that as soon as you see any patient who's unconscious on the road, how would you go? What would you do first? Like, first you see the safety of the scene, okay. You first see if there is you confirm the safety of the scene, right? And then you go, okay, you pat on the patient to see, you check the pulse, okay. So everything you have to do in stepwise, and there are points of each and every step. And at the end, the doctor might ask 2 or 3 questions. That depends upon how much time is left and how well you have performed. Then for the radiography, they will give you one X-ray I think in my case I got an X-ray of barium enema and one of orthopedic fracture. Two X-rays, so they'll just say what is the diagnosis and like what do you see in the X-ray. So you just have to mention that. Okay, it's not going to be very difficult. It is just that for interns who have been who have been alert and have seen during the internship, it's gonna be like a cakewalk for them, so you don't have to worry much about that. For surgery, again, they will ask you how to wear your gloves properly, how to put on your surgical drapes, how to put it off, how to do wound dressing properly, how to do the sutures, subcuticular sutures. So they will tell you to do that. So it's not that all of a sudden they will tell you. When you're there in the surgical department, they will make you practice, okay, both in a dummy, also on real patients. I was lucky enough to perform the suturing on a patient and closing the skin suture, doing the skin suture at the end of the surgery of a patient who had hernia. So you will also get a chance to do it on real patient as well. The only thing is that you have to be a little smart, you have to be alert, you have to show your effort, you have to know a little bit of your theory should be a little bit of strong, so that when the teacher asks, you can tell that okay, this and this is done and this is how it's being done. So then only they can have confidence on you, and then only they will allow you to do sutures in the OR on real patients. Okay, so for the exams, as I said, there's nothing to worry. No one fails in the exam, but it doesn't mean that we don't become serious or we take it so lightly. Okay, they actually conduct the OSCE exam, which is at the end of the internship, so well that you'll have a real-time feeling and you'll be like, wow, it was so fun to go into each room for just 9 minutes and choosing the topic and giving the exam and then getting the score and coming back. So it's actually very interesting and fun if if you pay attention in your internship period properly. Then this OSCE is not going to be very difficult for you, and you might end up scoring very good, in fact high score in your internship as well. So these are some of the important points which came into my mind, which is there in my mind right now, and I have shared with you. In case any one of you want to know something in specific more about internship, you can put your question in the comment box or send me an email, and then as soon as I get your queries, I will try my best to reply soon. And all the best to all the students who are going back to China, to Jinan, for their internship. Have a wonderful year. And yes, regarding the language, every department has doctors who can speak English. So if it's possible, when you go to that department, request your supervisor if you could do your internship under that supervisor. There will be PGT students, that is the postgraduate students, we call them Shiji or Shishong in Chinese. They also know, some of them also know English, so you can work under them, so that even if your Chinese is not strong, because there has been a gap of 2 to 3 years, right? And many of you are not that strong in Chinese. So if your Chinese is not strong, I'm not saying that don't worry, neither I'm saying that be relaxed. I'm just saying that try to be there in the hospital. Even at sometimes you don't understand anything, you can take pictures of the case reports. You can download a good translator, Google Translator or any other app, translate and see what the entire case report is all about. And as I said, every department has doctors who can speak English. Every department has PGTs who can speak English. So you try your best to be around them, so that if you have any issues, if you want to ask some questions, you can interact with them, right? And yes, because everything, all the case reports will be in Chinese. You don't expect the case reports over there in to be in English. and most of the things are not handwritten over there. Everything is typed. So being non-Chinese, we don't have to worry about typing case reports. They will not tell us to do that, right? But you should know to recognize a few medical Chinese characters so that you can understand at least the chief complaint of the patient, the name of the patient, the diagnosis of the patient, okay? And you could take a printout from there or take a photo from the screen, translate it and see with what kind of complaint the patient came, how many times the patient came to the hospital, what was the immediate treatment given, and so on. There are several other things, because for writing the case reports you have to take those case reports. You can take a print, go back to your room, translate it, and of course the translation is not 100% correct. Those apps are not, they have a lot of grammatical mistake, but at least you'll get the gist. You'll get to know what's wrong with this patient, okay? And then you can sit and write your case reports in English and then do the correction and all that and show it to your supervisor before your internship at that respective department gets over. So yes, you might sometimes feel a little different because of the language, because we are not that good in Chinese language, right? But then there's nothing to feel nervous or scared of that. You'll still have a wonderful experience, because honestly speaking, I'm not good in Chinese. Still, I managed to have, alhamdulillah, wonderful experience during my internship. And I've seen a lot of surgical cases, I've seen a lot of non-surgical cases, I've had a lot of wonderful experience in the hospital. So when I, as a mediocre student, as an average student, can do that, then why not you all people, right? Most of you are going there after cracking your FMG. So you people are more smart, right? You people are more brilliant. So don't worry about the language so much. Just keep an eye on the medical Chinese words. You remember whatever the Shu Fu Ping Lao Shi used to teach us, right? I'm sure you all might have the PPTs and all that. Just keep those words in your mind, like what do you say of vomiting in Chinese, O2, right? And fa shao, fever and all that. Just remember these words and remember their characters. You will be having your phone in your pocket all the time during internships. So, make sure you keep those in your phones and a good translator, so that whenever you need them, you can quickly take it out and use them. It's allowed over there. You don't have to worry. Okay. So that's all, my friend. This video has been too long, I know that, and it's actually not easy to sum up the entire 1 year internship in just a 1 hour video, but I've highlighted the important ones. As I said before, if you all have any other queries, you can please let me know and I will try my best to solve it. All the best, take care, have a safe journey, have a wonderful, knowledgeable, safe internship at花桥, and return safely and happy. Bye bye. Take care.